Okay, it's 5 o'clock, guys. And I want to begin the meeting of the Board of Health on May 9th. It's 5 p.m. And in keeping with an act relative to extending certain COVID measures adopted during the state of emergency as amended by Governor Baker on February 12, 2022, this meeting will be conducted remotely over Zoom. Attendance by board members will be remote, and remote attendance shall count towards quorum. The meeting will be broadcast live and recorded on ECAT. To use your Zoom, you will need to use the link on the agenda and download the Zoom application at www.zoom.us and create an account or use one of the call-in numbers listed on the agenda. You will need the webinar ID to join by phone only. While conducting meetings remotely, we will endeavor to keep meeting operations as close to our standard procedures as possible. However, use of this platform will necessitate some additional meeting protocols. While the board members or commissioners and applicants will be on video and audio, public participation will join the webinar as an attendee, meaning they are muted and with no video feed from them. During the public testimony portion of the meeting, members of the public can be recognized by using the raise hand function found under the participants from Zoom, or make a request with the Q&A function. If you're joining only by phone, you can press *9 to raise your hand. If an applicant wishes to display materials, please make the request of the chair in the email materials to board staff for sharing on screen. When starting testimony, please state your name and address for the record. There's a markup function in Zoom, which we will allow you to call out specific areas of presentation materials. As in any public meeting, indecent behavior will not be tolerated, and anyone who abuses use of the meeting platform will be terminated from the meeting. Business will be handled at the times indicated on the agenda. Business not concluded in the allotted time will be tabled to the end of the meeting to allow for timely logins and remote attendance. Board members are asked to announce themselves and make a motion, and second, they'll be clear to the audience, and take minute takers who make motions. All votes will be by roll call. When all business indicated on the agenda has been completed, the members will vote to adjourn the meeting, signaling the end of the meeting and the termination of the ECAT recording. All participants will be disconnected from the webinar at that time. So the first thing on the agenda is a review of the meeting format. But no, that's what we just did. First thing is the variance. Did they show up yet?
Yes, they're in there. That's Josh White of Jacobs Driscoll Engineering. If they'd like to make their presentation, that'd be great. And we'll go from there, and I'll make recommendations.
Yes, I'll pull up the plans right now. Hi.
Josh, just so you know, everyone here has had a copy of the plans for 12 Harlow in their packet. So
all right, great.
They do have it.
Great. Can everybody see that now?
Yes.
All right. All right, so first, my name is Josh White from Jacobs Driscoll Engineering. And this is our plan for a septic repair at 12 Harlow Street. It's an existing 2-bedroom house. The septic system currently is 2 cesspools in the back of the property. And we're proposing a drip irrigation system preceded by a singular treatment tank. This is really the only spot we could situate it on the lot, given the wetlands and the intermittent stream on the property. There's literally nowhere else we could go. And that's why we're here with this layout and requesting the several local upgrades and the variance for the separation to groundwater. So based on the sieve results, we needed 5 feet separation to groundwater, and with the singular treatment tank, we can reduce that down to 3 feet. And because we're within the 50-foot buffer of the wetland, that's a variance from the Board of Health. So that is our request. That's the most substantial one. The other ones include sieve analysis, um,
They have
setback.
the list in front of them on the
Yeah.
agenda.
Okay.
So just to give the Reader's Digest version of what Josh and Jacobs School of Engineering is looking to do. Because of the situation where they are and where they're located, Title V doesn't allow you to go within 50 feet of the wetlands and reduce the height of the water table together. So when you do that, it has to be a variance because you're not allowed to take 2 bites at the apple. And that's the reason we're doing, they're in front of you tonight. You know, you will see a little bit on the sideline of the house, but there's really no room to shoehorn something in there, if you can see with my cursor. So this is the only place that it could really go. They are going from 5 to 3 feet, which is allowed due to the treatment from the singular system. Because the water coming out of that singular system, which would be out of this front tank here, and then it goes to a pump chamber here. It's supposed to be water quality drinking standards. So that's another thing. The water coming out is very clear, effluent. It's quite a little system they're putting in here, and they're doing it because it does reduce the mound. They won't need giant retaining walls, and they might actually have a somewhat usable little backyard here, even with the system. And there'll be it's a 2-bedroom house, so there'll be a 2-bedroom deed restriction with it. But everything, I've reviewed the plan, everything looks good. They've given me all the documents needed for doing such a system and paid all the fees that go with doing 2 types of IA on the system. So my recommendation would be to approve the variance with the also the LUAs that are listed under the variance request. Questions?
I make a motion to approve for 12 Harlow Street, 2 variances and LUAs.
Seconded.
All those in favor?
Zias, yes.
Mills, yes.
LeBlanc, yes. Thank you for coming.
All right. Thank you, guys.
Sorry about my phone ringing.
That's okay. Now, let me just make sure, do we have to read out the entire variance? Or is it okay just to say,
As listed on the agenda, you know, unless you want to read out the whole thing. So in the past, as listed in the agenda, the only time you read it out is if something has been changed.
okay, okay. So that should be fine then. And then the reorganization,
That's you guys. Every time someone's elected or re-elected, you have to reorganize your board. And that means, you know, if you guys want to switch seats or whatever, and you can make a motion to do so, or a motion to stay the same. Or if someone has an interest in,
I was gonna say, does
Interested.
anyone have an interest in changing seats? I personally am totally content.
Chris?
Yeah, I'm good. I like being nobody.
You're not nobody.
Motion to keep Lynn LeBlanc as chair and Aria Zias as vice chair for
Seconded.
Board of Health.
All those in favor?
Zias, yes.
Mills, yes.
LeBlanc, yes. Okay, meeting format discussion.
okay, that's in your packet. And this is talking about whether you stay remote or go meet in person as of May 17th, or if you go hybrid where some of the people are, which I read it and I kind of skimmed over, to be honest with you. It seems like some people can go Zoom and some people meet in person here. So that's a discussion for you guys. I don't know if Lynn, you already spoke to Kristen about this, and
Yeah, so she did ask me what I wanted to do, and I wanted to bring it before the board because I felt we didn't all need to weigh in. And so basically we have options. Option 1 is to do fully remote meetings, status quo until July 15th, when they decide what they're gonna do moving forward. My understanding is that we can change that at any time. Option 2 is fully in-person meetings. And that would be on all boards starting May 17th. Limited meeting spaces are available according to Zoom. We can do like a pro and con of this. And then there is a third option, which is hybrid meetings. Is that an option to us? Available to regulatory boards with staff only. Limited rollout for now. So those are our options. I think I wanted to see what you guys want, what you guys are thinking. Any specific thoughts? And then I can share mine.
I'm completely ready to go back in person. I think it's a much more effective meeting. That's just me. I feel completely safe doing so. If somebody is unsafe, and they can always wear a mask or what have you, but I think we're ready to get back in person.
I think, well, I mean, we're really only talking 2 months, right? Theoretically, I mean, this is all changing in July anyways. We're just talking about the June and July meetings. So I'm fine either way. I feel personally like there's a little more attendance, more community interaction via Zoom. But if it's not going to be an option after July, I have no preference on these 2 months.
So I'm feeling what you both are feeling. And when I look at the pros and cons, there is, when I weigh it out, I'm feeling like I think there's some more pros to staying remote. Like Chris, when you're working, we can get you as long as you don't get called out. And we have never had this much community being a part of our meetings before, as we have doing remote. I think that's probably fallen off a little already, but we did have a heyday and people were watching. So that's kind of where I'm at. When I read the email from Connor, there's some discussion about there's one less meeting room now. So I don't know how much that'll impact us with being able to get a meeting room. It's, that might make it a little bit more difficult. But
Especially since, aren't we on the same night as the select board too?
Yeah.
Yeah, but the select board always meet downstairs. It's the upstairs. There used to be 2 meeting rooms and now one's an office. So
Okay.
that's where the meeting room got cut.
Okay.
So, and then on what was the date that they're gonna come back to us? Was it July 15th?
Believe so.
If on July 15th, it's still a, we have options, maybe then we should like really revisit it. That's kind of what I'm thinking, revisit it once again and see where we're at. What do you guys think?
I think that makes the most sense.
But again, I'm not saying that I'm against it. If you both came and said, no, we got to go back in person, I'd be like, yeah, that's fine. But does anybody want to make a motion?
I will make a
Does
motion.
anybody want to make any more comments? Okay.
I will make a motion to continue our meetings for the Board of Health via Zoom until we hear from the state otherwise following July 5th.
I'm so sorry. Gary?
Yes, it's all done on Zoom. Hold on.
There are clearly disadvantages to Zoom as well.
Seriously.
That
Phone's
was
ringing,
such
people are like, "Hey,
bad
what are you doing?"
timing. Okay. Let's continue.
I think we're waiting on a second, which might be you.
Oh, was that it? Okay, I don't even know where we left off. It got me flustered. I'm gonna second. I do wanna, with the stipulation that if this remains an option in July, we really need to revisit it because we can't do this forever. All those in favor?
Zeiss, yes.
LeBlanc, yes. Okay, the next thing on the agenda is
Number 5,
number 5.
novel coronavirus update.
Oh yeah, what's going on?
Okay, we have noticed some upticks. I don't have hard numbers, but I can just tell you from what I've seen in Maven. Stone Hill had a lot of numbers last week, but Tim can confirm that they're either done this week or next week for the summer break. I noticed today in
Yeah, they're in
Maven,
finals next week.
finals next week. Thank you, Tim. I noticed today there wasn't but maybe 2 Stonehill people in there, and there was 10 in the queue. So we are seeing a little uptick. I know other counties in Massachusetts are going higher and higher. Bristol County so far is still not seeing the same trend yet. That doesn't mean it won't happen, but hopefully summer comes around and takes the numbers down. But that's all I have right now, unless you guys see anything like Lynn at the school you want to add.
Well, look, I do want to say that I don't even know what I can say about the school, but I do want to say that those upticks we're only seeing in Maven are the PCRs. A lot of people are not getting PCRs anymore. Those are the
True.
only things that get entered into Maven. So I can say with certainty that there are many more cases than are being picked up in Maven. Just because
What
people,
percent would you think? Like 35% more than Maven, or
I
if you
wish
had to
I,
throw a number at it,
if I
just for
had,
the people at home?
well, I'd be really guessing because I really can't be sure.
Okay.
Because also in the schools, I think there are cases where people are getting it, staying out, doing the right thing, but I'm not necessarily certain that we're getting the info. So it's a really hard thing to pin down. But there's definitely more out there than is showing up on Maven. So if there's an uptick in Maven, for sure there's many more cases. I'm not hearing in the community that there's a lot of people that are very ill or being hospitalized. There are still some people that are getting ill, might need a little hospitalization, but I'm not hearing it's near as bad as when we started out without vaccines and stuff. So I just wanted to say that because Maven really, I don't think it's the best tool right now
Mhm.
to know for sure what's really going on. And I have heard that like the BA2, the newer variant is in and around. So we're still seeing new variants, which could be good if they're milder. That's all I really know.
Okay.
What about you, Chris? Anything on your end?
No, I just think the numbers are completely false because I think there's a bunch of people that test positive and don't report it. So you can talk about numbers all day, but just assume that they're low compared to what's really out there.
But
And
should
that's
they be
fact.
reporting it? Like, is that a thing? I
Well,
mean,
we talk about numbers, we talk about positives. Here's what the numbers are. Well, they're only as accurate as who's reporting it. Some people take a COVID test at home, test positive, and go, okay, I'm going to self-isolate for 5 days and call it a day. They don't report it, which is, perfectly fine, but it's stupid to even talk about numbers anymore.
So what happens, Aria, is when you get a PCR, it's with a healthcare personnel.
Right,
It's in a
right,
health facility.
right.
So it goes straight to Maven, whether you like it or not.
right. So my question was, if you're doing home tests, you're testing positive, is there even an expectation of calling it in and reporting it to someone? And if so, who would that be?
So in the school system, there is an expectation
Right,
that it is
Because of
reported.
DESI, yeah.
right.
Yeah, Department of Elementary and Secondary Ed. But you bring up a good point. Even if you called into the Board of Health, they can't put that in Maven. So how do you really track it, right? So I'm correct, right? Because they can only get it from their healthcare facilities.
Right.
Yeah, so, I mean, there's really no way to know, and I think that, it just makes it hard. I think you almost, probably the hospital data of who's going in and out of the hospital, might be better data to know who's getting very sick, but I'll bet you there's even flaws with that, that we don't know about.
And just for the public, so they know, we still have a few hundred test kits available. So if anybody ever wanted one, we've had a couple of people come to town hall to get them. So we do have some available.
So test kits to the town hall, and testing, they go on the website to try to find where vaccines, when you have your when you're doing vaccines at various town functions and stuff.
Yeah, we don't currently have the vaccine itself with Tim Vamosi, but it's still readily available at like the pharmacies, CVS, Walgreens,
Okay,
doctor's offices.
I have a question from someone who's actually attending the meeting. Pretty much, it's more of a statement. Primary care is not sending kids to get PCR if they test positive for rapid. They see no reason unless they're very sick. So,
That's
and this is
correct.
from Waltham firefighter local 8866. So,
and that is what I have seen across the board, that if you know, I mean, the antigen tests, there were more cases of false negatives than positives. So, and that's totally true. I can't remember one in the recent past that they've asked them to get a PCR. Adults neither, to be honest with you. Unless you go to the ER, there's not a lot of, some doctors' offices are, definitely pediatrician offices mostly doing, in my experience, have been doing antigens.
okay.
Is there another one there, or is that it?
No, it's just the one question or the one statement. So,
I think,
we're going to see moving forward, and I don't want to speak out of school, but more and more of testing at home, and this just becoming the norm for people at home. That's just my personal opinion. So,
yeah. Yeah, I agree. And I think this time last year, we actually saw it decrease a lot after April vacation. I think because the reason we are having an uptick and we're not even seeing everything that's out there is the masks. A lot of people have a lot of feelings about masks, but the truth is they do help. So if you are worried, put on your mask. If you don't want to, you don't have to. And then anything else before we move on? No. The Ebola tick-borne and mosquito-borne illness.
okay, just an update on the arbovirus. Just to let you know that the aerial application in the Hockomock Swamp was almost complete, and this was an email sent to us on April 22nd, and this was after the last meeting. So pretty much they completed that on April 22nd, the aerial application of larvicide, not adulticide. So it's attacking the larvae at the root source where they grow, not the adults that are flying around of the mosquitoes. So I just wanted to give you an update on that. Still waiting to hear back from the school when I go to do the tick and mosquito presentation. It should be the first week in June. We'll see when they get back to me. They just were trying to clarify some dates and stuff. So that's all we have on that. If you have any questions, feel free.
Anybody? Nope. Okay, the betterments.
Okay, 104 Randall Street, good standing with the town. They're looking for $48,731. They got their quotes. And so they're just looking for the loan so they can begin the work.
Okay, you want to do these as a cluster again?
Yeah, and in 91 Turnpike, same thing, 45,000. They're in good standing. And same thing with 210 Washington Street.
It seems like the prices are up from when I first started doing this.
Materials have basically doubled.
Okay,
It's sand, the Cultex, the infiltrators, even the pipe is pretty much doubled, is what all the contractors are saying. And then they're even like for pump systems, they're having a hard time getting the electric, the pump alarm, the control panel, just everything. It's just all due to COVID.
okay. Does anybody have any questions or concerns with those betterments? And does anybody want to make a motion?
I'll make a motion to approve the betterments for 104 Randall Street, 91 Turnpike Street, and 210 Washington Street.
Second,
All those in favor?
Zias, yes.
Mills, yes.
LeBlanc, yes. And then we have, we need to accept the minutes from April 11th, 2022.
Make a motion to accept the minutes from the Board of Health meeting for April 11th, 2022.
Second,
All those in favor?
Zias, yes.
Mills, yes.
LeBlanc, yes. And then does anybody have any staff or member notes?
Nope, it's just becoming camp and pool season for Tim and I. So I have my second camp inspection tomorrow afternoon, and Tim's already got some pool inspections to start next week.
Okay. All right, so I'd like to make a motion to adjourn the meeting at 5:26 PM.
Second.
All those in favor?
Zias, yes.
Mills, yes.
LeBlanc, yes. Thanks, guys.
All right,
Thank you.
thank you.
Have a great night.
Bye-bye.
Bye.
Bye now.
Bye-bye.